Hello, everybody. My name is Sheriff Dave Hutchinson. And welcome to National Sheriff's Association virtual panel on developing effective and low-cost programs to eliminate opioid use in your local communities. Again, I'm the sheriff from Hennepin County, which is in Minneapolis. Our agency has developed effective programs over the years to help combat the opioid crisis. We're looking forward to share what's worked for us, along with discussions with our friends over at Clark County to help ideas of what you can do within your local communities. Again, this has been a great initiative. So creating community outreach programs to address opioid misuse, especially important now, as the latest CDC numbers show more than 93,000 people, again, 93,000 people died of drug overdoses in just 2020. That's a 30% increase from a year before. Again, that's a staggering numbers, 30% increase in the year before. With opioid misuse on the rise, many of you are realizing a need for ongoing efforts to battle these problems in the communities we serve. Today, we'll discuss effective, low-cost, permanent ways to deactivate drugs at home, prevention and support options, how to effectively communicate outreach to your community with these programs, as well as how to fund them. There's a lot to talk about today. To share experiences and thoughts, we have an experienced panel representing Hennepin County out of Minneapolis, Minnesota, and Clark County, Springfield, Ohio. I'm pleased to introduce Dylan Gurna, Public Initiatives Coordinator from the Sheriff's Office here in Hennepin, and Detective Melchi from Clark County.
Thank you, Sheriff. Good to be here.
Before we begin, Detective Melchi and Dylan, would you share what your current role is and how you came up with the importance of creating this program to address opioid misuse in your counties? Detective Melchi, I'd like to start with you. Would you start to tell us with what you've been doing in Clark County, what you've been doing for years and years there. So if you could just introduce yourself and tell us what you're doing out there.
Yes, thank you, Sheriff. Again, Detective Brian Melchi with the Clark County Sheriff's Office in Springfield, Ohio. I've been on the department 21 years. I've been in the investigations division a little over 6.5 now. I was tasked several years ago with starting to assist with the drug overdose issues and coming up with ways to get unwanted medications and pills off the street. And we've really expanded that program in the past several years to places I thought we would never be.
Yeah, thanks, Sheriff Hutchinson. So my name is Dylan Gurna. I serve the residents of Hennepin County as the Public Initiatives Coordinator at the Hennepin County Sheriff's Office. So a little bit about my role. I focus on several critical initiatives to our agency's work in the county, such as our opioid education and Narcan training sessions, our drug take-back events, our community group partnerships, new initiative research for agency initiatives, grant coordination, and our outreach event planning and more. Our agency has been focused on an at-home disposal campaign here for about 6 years now, and we started it due to the dramatic increase in overdoses in the county. We have been fortunate to be supported by our Hennepin County Sheriff Foundation that has made it a priority by donating the Deterra bags to our agency to use in outreach. And to date, HCSO has provided over 50,000 Deterra bags to members of our community and partner agencies throughout the county. And we continually receive positive feedback from partner agencies and community members on the effectiveness of the Deterra bags and an at-home solution for medication disposal.
Detective Melchi, if I could start with you, can you tell us about the at-home disposal campaign in Clark County? I guess it began 3 years ago. Why did you start it? I think you touched on it a little bit, and how the results are sounds like they've been pretty well intended to the community. Can you touch on that briefly? I know you did a little bit.
We started the at-home disposal kits from Deterra 3 years ago. We were lucky to have received a donation of these. At the time, we weren't familiar with them. Once we became familiar with them and started passing those out to community members, at community events, and mainly also at our state fair or our county fair. They became a real success, to the point where people were asking us for additional bags. So at that point, we realized the effectiveness of them, not just at drug take back day twice a year, but throughout the year as well. We got to the point where we have equipped every cruiser with deterra bags. Uh, every deputy on the road can pass those out on calls. And again, we were now lucky enough to get a grant for a large number of these bags, to the point where we passed out over 3,600 just at our county fair in one week. And just since getting the grant recently, we passed out now over 4,200 of them.
That sounds great. And Dylan, could you answer the same question again? It's just tell us about what we're doing here in Hennepin County. Why did we start it? I know we started before you got here, but just results as well. If you can answer the question, great.
Yeah, absolutely. Thanks, Sheriff. So as I had mentioned, we have been working on an at-home disposal campaign utilizing the deterra medication disposal pouches now for 6 years. And it was started because of the dramatic increase in overdoses related to opioids in Hennepin County. I mentioned how we acquire them a bit, and some of the positive feedback. And Sheriff, you mentioned our Minnesota State Fair outreach. We continue to find ways to utilize these to support Sheriff Hutchinson's vision as it relates to reducing opioid fatalities in our communities that we serve in Hennepin County. But we use them in a number of ways throughout the county. We mentioned the Minnesota State Fair. For National Night Out, we actually offer them to all of our municipal police departments in the county. The sheriff has each and every year sends a letter to those chiefs offering a number of those cases to them, and we actually label them internally with the agency's logo. And so to date, we've handed out over 50,000 bags through a number of different outreach events. Our deputies also carry them and hand them out in the community as they're out on patrol and engaging with the community in other situations. We utilize them in drug take-back events, at our opioid education and Narcan training courses. We have lobby kiosks in each one of our lobbies. So every division has a kiosk that the public can walk into and get these bags. We also, our community outreach division takes them to any community events they attend. We take them to sheriff town hall events. And then during COVID-19, because our lobbies were closed, the sheriff wanted us to find a way to continue to provide these to the community. So we started a mailing program where the community was able to request a deterra drug disposal pouch. And through our foundation support for paying for the mailing, we were able to mail community members these drug disposal pouches that really helped kind of bridge the gap as we all adjusted to not being able to access normal avenues to secure these bags.
Thank you, Dylan. It's very, very informative, actually. Learned some things. So great work. And Dylan, we're going to keep on you. I'm supposed to speak up here a little bit. So what are the top 2 tips for departments thinking about starting a program in actionable ways to begin? So just go through what your tips are and what are some real things we can put in action to get these other agencies on board so we can help fight this horrible pandemic.
Absolutely. Thanks, Sheriff. So I would say partnerships and support would probably be the first tip. They're truly key to implementing a successful program. And that's needing support from agency leadership. We are very fortunate under Sheriff Hutchinson's leadership. He has continually supported our efforts to find innovative ways to connect the community with tools to combat these overdose and the dramatic increase in overdoses. And you also need support from the community. This is an excellent tool to create a positive engagement experience between law enforcement and the community on an issue that is impacting individuals from all walks of life and throughout all of the cities that we serve in our county. And you need a force multiplier. For us, other law enforcement agencies and community groups supporting have really helped us be able to expand the program, and it's been critical to our success. And so we know during the pandemic, it only exacerbated the opioid crisis, and the deterra bags have served as just another tool to help reduce the overdoses in our county.
Thank you, Dylan. Yeah, I agree. This has been a great program. I think if we can help other agencies start this, let's do it. And Detective, if you could answer the same question, what are your top two tips for other agencies trying to start this program? I know you've done a great job, so we'd love to hear from you, sir.
Of course, the main one of the main goals is to have our leadership, like Dylan also said, on board. Our sheriff has been 100% supportive of this program. She will stop at nothing to provide us the resources and the tools needed to do this. And we need support from our staff as well, not just administrative staff. We need support from our deputies on the street and our deputies that work in other divisions here to get the word out on these. The more people know about these disposal bags, the better it is. So if we can get the community to realize the goal of these and how good these are, it's a great program. And we started the program, and people were questioning what they were, and we have people showing up now asking for multiple bags because the word has gotten out there to let people know what they are and how they work. So a combination of the administrative support, but then also letting the community know, and getting them well informed of this, it really helps out a lot.
Thank you, sir. Appreciate that. And either one of you, I think Dylan will go. We'll go back to you. Both of your teams have literally handed out tens of thousands of at-home disposal pouches. Can you share some of your advice on how to effectively educate people about the importance of the at-home disposal pouches, the effective way to dispose of your unused medication? I know you've touched on a little bit, but um, again, with all these bags out there, how do we get out there and educate people? I think at the state fair, most people knew what they were. They necessarily weren't super comfortable with it, but you have any ideas we can get the education out there ASAP?
We continually have individuals coming up to us, and the state fair is a perfect example, who have heard about the bags. They've either received them previously through outreach events, or they've heard from other community members on how easy they are to use and how it removes a lot of barriers. And so through our outreach, one of the important educational components has been really utilizing the back of the disposal pouch. All the instructions for use are on there. It's super simple to explain. So when either our deputies or our civilian leadership, as we hand those bags out to the community member, we spend a few moments to help educate by just referencing the back of the package as a way to explain how to properly dispose of them. It's kind of twofold for a lot of our outreach. We not only use this as a tool for them to do it at home, but then we try and connect them and identify both within the county and statewide where their nearest medication disposal site may be, to give them options. So if they have a large amount of medication and they want to drop it all off versus using a tool such as a disposal pouch, we also try and connect them with those resources as well.
Thank you, Dylan. Detective, if you could add on, that would be great.
Yeah, everything Dylan said, I would agree with. We also, in our county here, will actually, if people call in and say they have a large number of medications, we'll have, say, an elderly person call in, and maybe it's not easy for them to drive out to our location, or not easy for them to park across the street and have to walk up all the steps out here. We'll actually drive to their house and pick them up, and dispose of them for them. So again, making it as easy as possible for people, a combination of that, and then if they can utilize the bags, that makes it super easy for people. We can drop off bags to them, and they have several the terra bags at home, and they don't have to even leave their house. So I think the easier we can make this for people, I think the better. And like Dylan also said, it's the bags are very self-explanatory, very simple to use. But of course, we're always willing to walk people through that process as well.
Yeah, I agree. I brought some over to my parents. They live in a condo development that there's some elderly people there, and uh, again, just explaining it to them for 3 or 4 seconds, pointing out the directions, they got it fairly easy. So, and Detective, going back to you, can you share some tips, both of you actually, share some tips of how your organizations help funded this opioid at home disposal program? Because again, as we all know, in some parts of the country, Minneapolis being one of them, um, you know, funding isn't always the best. People are talking about cutting funding. So, what are some tips on how we can get these organizations funded so we can bring this great program everywhere?
Sheriff, here in Clark County, the first time we started using these bags, we were fortunate enough to have an organization donate some to us. And once we realized the effectiveness of them, we started having our grant writer here at the sheriff's office explore grants that could possibly pay for these. And we were very, very fortunate enough to be awarded a national grant to help us pay for all of the Deterra bags that we pass out here now locally. Like I said, since starting that grant just a couple of months ago, actually, since we got the bags, we've passed out over 4,200 of them. And then, of course, we have our drug take back day coming up next month, and we'll pass out a very large number of those at that event as well. Like I said, previous drug take backs, we have passed out one bag to each person. And in the last year when we did it, people came in and actually asked for additional bags. So it just goes to show that the program's working and people really do like these bags to use them at home.
And Detective, after going get some tips, I really like to see kind of how these bags work. Granted, I know what they do, but after going, if you can give some, funding tips to our friends in different agencies, hopefully start this program. Can you give us a few tips, and then Detective will go back to you to demonstrate how easy these things are to use. So we want to make sure to give you time for your prep, so you can make sure that we're all impressed.
Absolutely. Thanks, Sheriff. And so similar to what the detective shared, the disposal bags, we are fortunate enough here in Hennepin County that our Sheriff's Foundation, through the RX Abuse Leadership Initiative, were able to acquire through grant funding. So we did not have to use operational funds to acquire the bags. And do not use operational funds outside of the payroll that's used for engagement events and activities that we would have already been present at. And as the individual who coordinates grant funding for our agency, the detective mentioned, there are several grant funding opportunities out there, both from, here in Minnesota from the state level, and certainly at the federal level, to support acquiring funding for implementing these types of programs and acquiring these tools for agencies across the country.
Great, thank you, Dylan. And I just want to point out that we really appreciate what you're doing with this initiative. Plus, it's nice having you as a grant writer because you're so much more versed in that. So, Detective, if you're ready, let us know.
I am, yes. So this is what the actual bag looks like. Again, very, very easy for patrol officers to carry in their cars. And again, I think Dylan pointed out they actually have these in their lobbies that people can come get. And it makes it very easy, as small as they are. You can put several out there. They don't take up a lot of room. So on the Deterra bags, on the back side, it's a very simple 3-step instruction. You tear the top half off there, and we have a bottle of medication that has several pills in it. You just simply pour those into there. And then it's a simple process of just you fill the bag approximately halfway with water. And then you wait approximately 30 seconds on that for that to start activating on the inside. It is very important. If you point anything out to the people, they only have to tear open the top lid. The internal package that stays sealed, no need to do anything with that. But then, after the 30 seconds passed, after you filled it, halfway with warm water, you just simply, it's like a Ziploc bag, and you seal that, and you can gently shake that up just to kind of activate the contents inside. And once that happens, it's very simple to just dispose of in your trash can at that point. Same thing can be done with liquid medications. A simple bottle of cough medicine here. It's the exact same process. So we just open a new pouch and we pour you pour your liquid in there, and it's still the same process. Even though you're pouring liquid in there, you still fill it halfway with warm water, which will help activate the contents in there. And again, you would wait 30 seconds on that process. And once that is done, you would seal the bag again, shake that to activate the contents, and that's ready for your trash. So again, the bags can't be much simpler. You have about a minute involved in the whole process from start to finish. So very, very easy way to dispose of, some medications you have at home. It can take, 6 ounces of liquid, or it can take up to 45 pills. And another nice feature that I see on the bag as well, you can also put patches in there. We have seen an increase of medication patches that are turned in during drug take back. So, again, just another tool that has been provided by Deterra to be able to dispose of these at home a lot easier.
That's great. And I actually had an impromptu question, but you already answered with, the patches. And now a guy locally is doing a lot of these pills with, the strips that you put in your mouth and dissolve. So those obviously can go in there as well. So thank you for that demonstration. And it is easy. I think people need to know that, especially our elderly friends. It's pretty simple. I mean, these are, whoever designed this designed it for ease and to get rid of unwanted medication. So we love them here in Hennepin County. And then we'll give the detective a little break. Dylan, how do you plan to evolve this program over the next few years? I know you have a lot of good plans. We're excited.
Yeah, absolutely. Thanks, Sheriff. So we continually at our agency are assessing and discussing ways to get more tools into the hands of community members to safely dispose of medication. The Deterra medication disposal pouches, as the detective talked about, truly remove some of the barriers to, proper medication disposal, such as those who may have some level of disability, may not be able to access some of our facilities or medication disposal sites, those who may lack transportation, and other barriers that are created. So we're continually looking at ways to get these pouches in the hands of residents in the county. And each year we increase the number of events and outreach work we're doing around opioid education and proper medication disposal. So we're continuing to put energy toward developing those innovative ways to engage the community. And then we're also focused on creating new ways and new tools for outreach and to assist community members with drug disposal, and then also with education should an overdose occur. And we're doing that through virtual means and then certainly in-person trainings as well.
Perfect. Thank you. And Detective, can you elaborate on that? Again, what's your plan to evolve the program with your agency in the next few years?
Yes, it's sad to say that when I started this 3 or 4 years ago, we had one drug disposal box at our East District office, and that is all we had. And at that point, our agency was not even participating in the National Drug Take Back Days. That has completely changed. We now have 2 collection sites on Drug Take Back Day, and just this morning, I delivered a new drug disposal box that people can put unwanted medications in at a firehouse in the southeast part of our county. So we're now up to 4 disposal boxes throughout the county. And then, as I said, every car is equipped with these bags. We pass these out at every community event we possibly can. We are partnering with some of the McKinley Hall services here in Clark County. They are also assisting us in passing these bags out to people that might have an opioid addiction. Hopeful that they take these medications they have and dispose of them properly instead of taking them, and then our overdose rate continues to rise.
Perfect. I think we have time for one last question, and this is probably the most important question. And we can start. I think we'll start with the detective because don't taking his little break there. But detective, if there's one key takeaway you want employers to remember from this panel, what is it?
I think after employers see this panel and demonstrations and the discussions we've had, I think it should be pretty clear for them to see how easy it is to implement a program like this. It, it does take work, but the ease of doing it and the ease of explaining it and the ease of getting people involved is the easy part. You have to have somebody that's willing to be a go getter on it and be willing to put in the time and effort to do it. But if you have that, I think that every agency should have something like this. The opioid addiction is not just in one county, it's not just in one city, it's all over the United States. And I think the numbers are very clear on that. And I think I would love to see every agency have some sort of plan in place to help with this. And the bags are a great resource to do that. And there's many ways that people can find funding without going into their actual budget at that agency to get these bags. So I think it's something that every agency should try to look at and try to implement in some way to help the overdose rates.
Perfect. Thank you, Detective. And Dylan, before I have you answer that same question, I just want to point out that, again, this is uh, an issue that affects everybody from all incomes, all races, ethnicities, you name it. So again, this program works great. We've seen it work in Hennepin, and hope we can get it roll out nationally. And Dylan, again, just point out a key takeaway you want employees to remember. You could do it briefly. That'd be great.
Absolutely. Thanks, Sheriff. And I would just echo the comments from the detective on the simplicity. And once you acquire the funding to obtain these bags, it really is just about building out that program for how it makes sense for you. It's a great tool. It's been well received by community members and law enforcement partners alike. And as I mentioned previously, it really creates a positive engagement experience between law enforcement and community, and it helps to remove the barriers such as the lack of transportation. And at the end of the day, the easier we make it for proper medication disposal, we do believe that this is going to reduce the avenues to overdose and the amount of abuse that we do see.
A great answer. And again, thank you, Detective Malachi and Dylan, for a great discussion. And thanks to those who listened today. To learn more about home disposal, please visit deterrasystem.com. Again, that's DETERRA system.com. Again, thank you for your time. I learned a lot. I hope our listeners and viewers learned a lot. I think this is one program we can get throughout the nation. It's going to reduce people taking medications they take. It's a great program, and hopefully we can get funding from our private partners and throughout the country because this is a good program. It's going to work. And I think again, thank Deterra and the system, and thank you for being on.